Hi, I'm Justin Riley. Today on Wisconsin Doctors, we are on location at the Wound and Edema Center of Fort Healthcare here in Johnson Creek, and we're going to find out why the team approach to wound care is the best way to go. So if you have chronic wounds, stay tuned, you'll want to find out more. We're joined by a fabulous team of folks here who are all involved in the team care approach for chronic wound care, including Dr. Jeff Smith, who is a certified wound care specialist, Mary Carvalho, the clinical coordinator here at the Wound and Edema Center, and Carol Striegel, wound care nurse. That's all coming up right here on Wisconsin Doctors. Stick around. Welcome back to Wisconsin Doctors. We are here on location at the Wound and Edema Center, part of Fort Healthcare, right here in Johnson Creek. And today we're going to talk about the issue of chronic wounds. And I'm joined now by Dr. Jeff Smith, Doctor of Osteopathic Medicine. Dr. Jeff, how are you?
I am good.
Good.
I'm glad to be here.
Yeah, thanks for having us today. So I want to start out by talking a little bit about what chronic wounds are. Can you explain to our viewers what is a chronic wound?
Okay. A chronic wound is basically a wound that has, for various reasons, failed to progress in the normal process of healing. Typically, we expect that wounds are going to go through several different phases of healing, and at some stage, wounds occasionally stall or become hung up, and then thus chronic in nature there.
Sure.
This can be due to a number of circumstances, including circulatory issues, infection, diabetes, nutritional issues, and also mobility problems related to neurologic issues as well there.
So it sounds to me like the mobility issues would kind of lead to maybe the circulatory problems that would cause
Well, sometimes they all go hand in hand,
Really?
and it's not unusual to have a patient who will have obviously a combination of these factors contributing to their lack of healing.
Sure, yeah. So what is the average time that it takes to heal a chronic wound? So obviously a chronic wound is something that's not going to heal on its own, so we need to apply some sort of treatment to it.
Right.
What's the average amount of time that something like that takes? I know that's a pretty broad question. But.
You know, obviously that varies. At our clinic, our average time to heal is around 34 days.
Okay.
The national data system that we report to gives an average of about 68 days.
Oh, wow.
So there's quite a variation, and it obviously depends a lot on the type of the wound and the complexity of the patient as well.
Sure, so there's a lot of different factors, but there's a lot of different ways that you guys can treat those wounds here.
That's true, and you know, we take what I would consider to be a multidisciplinary approach. Using, you know, physicians who have had additional training in wound care, as well as nurses who have specialized in wound care, and in our clinic as well, edema therapists, which can be very important.
And that's one of the great things about the Wound and Edema Center here is that everybody has had extensive training on how to manage and treat these chronic wounds that patients are bringing into them.
This is true. That's all we do here.
Yeah, absolutely. When is it a good time for somebody to involve a wound care center such as the Wound and Edema Center here at Fort Health? When do people finally have to say, okay, enough is enough, I need to go in and have this checked out?
Well, that's a good question. I think certainly when the patient and their physician come to the conclusion that the wound is not healing in a normal fashion, that would be a time for consideration of referral. Also, if the patient with the wound has multiple medical problems that may be contributing to slow healing, they may want to come in sooner rather than later. In cases of diabetes, circulatory issues,
Yeah.
some of those other things that we alluded to.
Sure, absolutely. And one thing that we've been here a couple times now is that I think is really unique is that a patient can actually self-refer here.
They certainly can,
Yeah.
and we welcome self-referrals, though
Sure.
we do like to try to keep that connection with the
Right.
primary
Yeah.
care physician as well.
Yeah, so that there's somebody who's kind of managing the overall health concerns if there's something else
Exactly.
behind the wound. So we talked a little bit about why it's so important to see both a primary care provider as well as a specialist in conjunction to treating a wound. But what are some other reasons why someone needs to stay connected with their primary care physician when they are here getting their chronic wounds treated?
Well, I would say the majority of patients that we see have multiple chronic medical problems, and this includes diabetes,
Sure.
Heart and circulatory issues,
Yeah.
and those need to be well managed
Right.
to actually contribute to the healing process as well.
Yeah, because if you don't manage the cause of the problem's really not going to go away.
It's much more difficult.
Yeah, absolutely. And is there anything that a patient can do themselves to manage or help expedite the process of healing their chronic wound?
Well, I think the patient plays an important role in being responsible for their health care. In other words, complying with their diabetic regimen, paying attention to their nutritional status,
Sure.
trying to discontinue or at least decrease smoking, which is always a huge issue. So there's a lot of issues of personal responsibility that can be very helpful in contributing to the healing of a wound.
Absolutely. And one other question before we go here. I'm just kind of curious to know what percentage of folks that come in here have some sort of other health concern that might be leading or contributing to that chronic wound versus people who might just have a wound that's not healing? I mean, is it 100% of the time? Is there something else going on?
I would say it's at least 90% of the
Okay.
time. Yeah, it's rare that we have somebody who is in perfect health and is not healing.
Right. There's usually something else going on there.
Right, absolutely.
Yeah. Well, Dr. Jeff Smith from Fort Healthcare's Wound and Edema Center, thank you so much for joining us today.
Well, thank you for having me.
I appreciate the information. If you are experiencing any of these symptoms that we talked about here, come and see the folks here at Fort Healthcare at the Wound and Edema Center, or go see your primary care physician and ask to be referred here to the Wound and Edema Center for Fort Healthcare. We'll be right back with more Wisconsin Doctors, so stick around. Hey folks, welcome back to Wisconsin Doctors. We are here on location at the Fort Healthcare Wound and Edema Center here in Johnson Creek. And I'm joined now by Mary Carvalho, who is the clinical coordinator here at the Wound and Edema Center. Mary, welcome. Good to see you again.
Yeah, nice to see you.
Yeah, always good to see a familiar face on Wisconsin Doctors.
Exactly.
So we're going to talk a little bit. We've been talking about wound care today, obviously, because we're at the Wound and Edema Center. You guys have a great team approach here, but we're going to talk specifically about how to dress these wounds. So talk to us a little bit about what kinds of dressings you use, and how do you know? I mean, there's obviously so many different varieties here. How do you know which ones to use?
There are, and that's part of the whole thing with wound care. It's not just enough to slap a Band-Aid on something. If it was,
Right.
we wouldn't exist.
Exactly.
To heal a wound, it needs to be in the perfect setting. And some wounds are really wet, and some wounds are dry. So we have things such as an alginate that dry things out.
Sure.
Although we have the big black tube there,
Okay.
which is a hydrogel, and that moistens up a dry wound.
Okay.
And if a wound has these purple things
Okay.
or blue things, they actually have methylene blue and gentian violet in it, totally natural things, and that they help to knock down what we call the bioskin stuff. So it's just a little bacteria that it lives everywhere.
Sure.
But when it's living on top of a wound, it prevents it from healing.
Right.
So that you can see they come in all sizes,
Yeah.
shapes. They
Yeah.
have silver impregnated in it,
Okay,
and silver
wow.
prevents the bacteria from replicating. So we use silver a lot, but every one of these has its place. And if a wound is dry and I put an alginate on it, I am now creating the Sahara Desert, and it's not going to heal.
Right.
So every one of these has a purpose, and that's part of wound care. We know what your wound needs, and it'll change throughout the healing cycle.
Sure, yeah. It sounds to me like, in general, balance is what's needed to heal.
Absolutely.
So if it's too dry, it's not going to heal. If it's too wet, it's not going to heal.
Right.
Yeah.
And that's why your average GP doesn't know and doesn't have access to these things to use them.
Yes, but you have access to them here, which is great. How do patients afford certain dressings that are vital to their healing process? Because I imagine that if it's only available in certain places, that there's probably a little bit of a price tag on it. So how do patients afford that?
They are. These are all probably very expensive, with the exception of the plain gauze.
Sure.
We work with the insurance companies, and we go through third-party companies called DME companies.
Okay.
And we send your insurance company to them and what you need in supplies. And they contact the insurance company, and they get the agreement that the insurance will pay for it. And they deliver it right to your door, usually within 24 hours.
Oh, so they don't even have to, the patient doesn't have to come here to get them. They can be delivered directly.
No, absolutely. Wow. And that way, it keeps us out of things. We're not set up to say, well, I'm going to give you 3 of these and it's going to cost you $5.
Yeah.
It doesn't work that way. The insurance company handles everything.
Yeah, that's awesome. And it's awesome that you are willing to work with the insurance companies at that level so that the patient doesn't have to worry about that. They can worry about helping themselves get better.
Otherwise, they're in 6 months from now, they're not going to be healed.
Right.
And we're back where we started.
Yeah, absolutely. So when you help a patient who might have limitations for managing their wounds, because obviously some folks, as we talked with Dr. Smith just a second ago, there's oftentimes at least a 90% chance of there being something else going on with that patient's health that might cause these wounds to not heal. And some of those might manifest themselves in limitations, certain physical limitations that might not allow for a patient to manage the wounds on their own. So how can you help some patients who might have trouble managing wounds on their own?
We try and talk to the patient and get an idea whether or not they have children, caregivers, neighbors who are interested in helping them. We have them come in, we teach them how to put the dressings on, we give them written instructions. If they don't have anyone that they are comfortable with, and that's half of the battle, is being comfortable with this, then we look at home health as a possibility. And we'll write a consult to home health. If all of that fails, we have them come back to the clinic, however many times a week they need to come back, and we do their dressing change for them.
Yeah, yeah. So you have the option, or the patient has the option of coming back here, but
yes,
if at all possible, you're going to try to get them that support in their home if they can get it.
It's so much easier, especially in the middle of winter. We don't want these old people risking life and limb on ice to get here for a dressing change. You want to sit in your living room and say, hey, put out your foot.
Right. Yeah.
To fix it.
Yeah, absolutely. Yeah, we don't want to have another injury for them to get here and have to heal that too. So, why is it so important to use these specific dressings? I mean, obviously each one of these has its own purpose. Why is it so important to use these specifically?
What happens at each different phase, sometimes a wound will have a very, very thin covering on it, and if you use the wrong thing, for instance, if you just slap gauze on it, when we take it off, that thin layer of skin goes right with it. And that's a problem. We want to enhance the healing of this wound, and our goal is always that 30-some days to get you in and get you out. And then if we do a setback, you don't have a dressing big enough or absorbent enough to work, then, and the wound gets wet, we just keep going backwards.
Yeah, you're backtracking instead of moving forward,
Exactly.
so
And
which makes it worse.
And it's really frustrating, and it's frustrating for the patients too. They're like, last week it was 3 by 5, and I was so excited, and this week it's 3 by 6. Well,
Right. There's reasons for that. There's reasons for that. So well, it's always so impressive to come here and see the type of tools that and resources that you guys offer patients when they come through the doors. And Mary Carvalho, thank you so much for joining us today. It's been a pleasure talking with you again.
Well, thank you for being here.
Yeah, absolutely. And don't you go away. There is more Wisconsin Doctors coming up right after this. Stick around. And welcome back to Wisconsin Doctors. We are here on location at the Fort Healthcare Wound and Edema Center here in Johnson Creek. And we've been talking about chronic wounds and the care of chronic wounds. And my next guest is Carol Striegel, who is a registered nurse here over at the Wound and Edema Center. Welcome. Good to have you with us.
Thank you. Thanks for coming.
So you guys emphasize a team approach when you're talking about the care of chronic wounds and edema and that sort of thing. So we're going to talk a little bit about the coordination of wound care, and I'm wondering if you can talk to our viewers about who all is included in the wound care team.
Sure. The team here at the clinic includes the nurses,
Sure.
Our physicians, which includes 2 podiatrists, our nursing assistant, administrative assistants, our hyperbaric oxygen technician, and our lymphedema therapist.
Very cool.
But the most important person of that whole team is the patient and their caregiver.
Yeah, that's really interesting that you say that, because that's one of the things that we talked about earlier in the program with Dr. Smith, is that there's a lot of things that the patient can do themselves to try to expedite the process of healing, which is important. So
That's right.
yeah, absolutely. How do you reach a wide variety of individuals who are in need of your care? Obviously, there's folks out there who may be experiencing chronic wounds, wounds that don't heal, and they don't know where to go. How do you reach those folks?
Through marketing,
Sure.
for one thing. People find us on the internet.
Yeah.
Frequently, it's a referral from their physician. They send them to us.
Yeah.
You don't need a referral to come here.
Right.
A lot of times it's word of mouth.
Sure.
Neighbors, friends, home health frequently will have people come and see us.
Okay.
So,
just a variety of different avenues there.
Yeah.
I think it's really cool that this is really a state-of-the-art facility here. I mean, you guys have a lot of really, it's top of the line equipment and top of the line providers as well. So
That's right.
It's a really good place. I mean, you're really well cared for, and you guys have that team approach down, which is great. What do you personally do here at the Wound and Edema Center to help manage the care that the patients receive?
Actually, a lot of things. Since we do the team approach, we work very closely together. We come up with a patient-centered care plan.
Sure, okay.
Education is huge. It's much easier if they understand why we're doing this, why we want them to do that, instead of just saying, do this, and then trying to, most of us just like, yeah, whatever.
Right. Yeah.
But we communicate with their other providers.
Yeah.
We make referrals to specialists as needed,
Sure.
like vascular specialist,
Sure.
infectious disease, home health,
Yeah.
diabetic educators.
Right, yeah. And
Multiple.
that's again that kind of goes back to the whole team approach and how the fact that if you have a chronic wound, chances are there's at least a 90% chance that you have something else going on. And so the buck doesn't always stop right here at the Wound and Edema Center. You guys will work with other clinics and try to coordinate the care that they need, even if it's in multiple different locations with multiple different providers.
Right, absolutely. And that person's primary care provider is huge in this
Yes.
whole picture also.
Yes, absolutely.
A lot of times our patients will be like in nursing homes or group homes or through home health, and we're in contact with them all the time.
Sure.
We really need that feedback about how things are going. If something's not working, we need to know about it so we
Right.
can adjust it.
Right. Kind of cater towards the individual needs of each
Absolutely.
patient. Yeah, that's important. What are some things that patients can do on their own or in conjunction with their either primary care providers or with the folks who are here at the Wound and Edema Center to contribute to their own wound care?
Actually, quite a bit. We really want them to take responsibility for their own wounds.
Sure.
We're just guiding them.
Sure.
You know, a lot of it comes down to what they do or don't do.
Yeah, lifestyle type of things.
Right, right. We really want them to be active participants
Right.
in this care. You know, we want them to come to their appointments. We want them to be willing to make some changes if needed
Sure.
for wound healing. But the bottom line is that we're here to help them through
Sure.
all of that. You know, they're not alone in this.
Right. It sounds an awful lot like you guys kind of just provide, not only do you provide the actual resources for healing here at the clinic, but you also will provide tools for the folks to, you know, whether it's through education or through, you know, exercises and that sort of thing, things that they can do at home that allow people to, you know, expedite the healing process on their own as well. You can you provide tools for them, but it's
Yes.
sort of up to them to use them.
Exactly.
Yeah.
Exactly.
Yeah.
Yeah.
Yeah. You can lead a horse to water, but you can't make him drink, as I've heard once before.
Absolutely,
So advice
yes.
before, okay.
Yep,
How
that's
long
true.
have you worked here at the Wound and Edema Center?
About 5.5 years.
Okay.
Yeah.
Okay. Well, I'm just curious, what brought you into this field? I mean, there's so many different avenues for a registered nurse to go into in terms of healthcare. What brought you to this the Wound and Edema Center?
I used to work in home health, and we
Okay.
saw a lot of chronic wounds there, and it just kind of grew from there. And I came here, and I realized I didn't know much.
Yeah. Yeah.
You learn every day.
Yeah.
We learn every day, and it's exciting and rewarding.
It sounds like by coming here, you really have the opportunity to experience a lot of personal growth as well.
Oh, absolutely.
Yeah, that's
Absolutely.
awesome. Carol Striegel, registered nurse here at the Wound and Edema Center. Thank you so much for joining us. I appreciate it.
Thank you.
And that's all the time we have for today on Wisconsin Doctors. From all of us here at Channel 57 and Fort Healthcare's Wound and Edema Center, we invite you to live longer, live better. We'll see you next time.